So this week, we're discussing, is EA too far removed from the communities it serves? What is effective altruism? It's two things. First, it's an idea that you should maximize the good you can do through your career, your projects, and your donations. It's also a community of many different individuals and organizations who care about this idea and gather around it. So we are the Christian EA community speaking here on this call. Some quick fast facts about the community of EA that kind of focuses our discussion for today. Within EA, there's this big focus on maybe 4 cause areas, broadly speaking, at least traditionally. These are global health and development, animals and animal welfare, the long-term future and safeguarding the future of humanity, and the effective altruism movement's community building. It now has thousands of people. I think the last EA survey put it at something like a few thousand very, very active EAs, but tens of thousands plus who've been affected by this, and mostly in the English-speaking world. There are many local groups, dozens, perhaps hundreds of chapters across cities and universities across the world. And yeah, there's quite a lot of money committed to EA now, as we know from earlier this year. There's an estimate from Toby Orr that close to $50 billion had been committed. Of course, that relies a lot on a few rather wealthy donors, but we're talking now about quite a large amount of funds that are channeling through the effective altruism movement towards helping the world. And we have institutions that have been founded through EA networks, especially in Oxford, Cambridge, Georgetown. And so it's fitting that we ask this question, is EA too far removed from the communities that it serves? A lot of EA networks are in more developed places, and a lot of the communities EA is trying to serve are in less developed places. One big community that EA tries to serve are citizens of lower income countries. If you look at where AMF has done their work against Malaria Foundation with distributing bed nets, these have been especially in the DRC and Ghana and across the world, but especially sub-Saharan Africa. If we look at other communities that EA serves, we also come across animals, especially animals in factory farms, and then also future people. And for each of these, we can ask whether EA is actually close at hand to assess the needs of these communities. We can ask, is EA getting a relevant picture of what individuals in these communities are suffering from? And does EA have a good sense of what would actually help? So I want to ask a few questions here to maybe hone in on our discussion, and maybe we can answer this all together as a group or in our small groups. But the first question is really, are the programs of effective global poverty and health charities meeting the greatest needs of their beneficiaries? And how do we really know that, right? There's a lot of criticisms of EA and I guess of aid more broadly, although EA isn't just foreign aid or isn't just randomized interventions. But there is this criticism that when we're doing aid, that it can be paternalistic. It can be very much people in Western high-income countries just telling people essentially in lower-income countries what's best for them or what they need, and there's not always a good loop of information between the two. One thing I found interesting when researching about this is this concept of stated preferences versus revealed preferences and figuring out what people actually want. In economics and in development, a lot of time we have to ask people what they value, and that would be an example of a stated preference. We might ask people in a poll between two things, for instance, having a longer lifespan or having more income, which they would prefer. And so that gives us like a nominal answer for what people would prefer. And we can poll people in poor countries. Then there's this thing called revealed preference, which is different from stated preference. It's not what people say they would prefer. It's what people indicate they would prefer based off of their actions. And so we can look at things like how much people are willing to take a riskier job that might put them in the hospital or might have a higher mortality rate for an increased income. And governments and aid charities around the world have found their own estimates for these sorts of things. But actually, most of these polls and studies for stated preferences and revealed preferences have been done among citizens of higher income countries. They haven't been done very much among citizens of low income countries. There's really not a lot of research here. And some people here on this call with more understanding of the literature, I'm thinking of Rob, I'm thinking of Colin. I'd love to hear what you understand about this. But from my reading, especially from GiveWell's research, there really isn't a whole lot in the literature on this in developing countries. Then there's another question which is related. How do moral weights compare between donors, NGOs, and recipients? Once we have people's preferences, like what they say they prefer to have, or what they indicate they prefer to have, we can ask this question of, okay, how do we efficiently allocate between interventions? We can take this example. Is it better to save a child under 5 from malaria, for instance, or to double a poor family's income for 1 year? This trade-off represents a real trade-off that donors face when they can give, on the one hand, to a group like Give Directly, and on the other hand, to AMF. Is it 3 times better to save a child's life? Is it 10 times better to save a child's life? Depending on how you answer this question, it affects where you should donate. And right now, GiveWell is recommending top charities based off of certain moral weights for each of these outcomes, which may or may not reflect what people on the ground actually want. So how do moral weights compare between NGOs like GiveWell, the donors like us, or whoever else is donating, who is trying to make the most sense they can out of GiveWell estimates, and the recipients who are hopefully being benefited from the donations? And then finally, is there adequate communication between these 3 groups? Maybe right now there is some kind of mismatch in moral weights. Maybe right now the programs of effective charities aren't meeting the greatest needs. How is it that we can ensure more adequate information to pass through these 3 groups? How can we get a better sense of the needs of the communities that we're serving? And what would that look like? Would that look like better serving? Would that look like institutional serving, or just individual trips? Should we physically go to these communities? That would be something I hope we can talk about. But I'd love to hear more from all of you, but I'd love especially to hear from Esther, who had a great discussion about this topic with Sonia on the Slack about a month or 2 ago. Esther, if you have a few minutes, I'd love to pass it on to you and hear what you have to say as well.
Okay, thank you very much for this opportunity to share my thoughts and knowledge. So first of all, I like to say that EA is doing great. Although the truth is there are some limitations in its effectiveness, especially in the poor regions, which need or require more attention. And now I like to read some figures. So I did a research, and so before I go into this, so most of the regions, the poor regions that EA addresses issues of global health and poverty in most of these countries are situated in Africa. And from my research, in 2022, around 460 million people in Africa are living in extreme poverty, with the poverty threshold at $1.90 a day. The number of poor people on the continent increased compared to the previous years. So now this is a question. Considering the funds that is being made available to solve this cause, why is there high rate of poverty in this region? From my research, I came to find out that some charities who are focused on solving problems in Africa, where we have most of the poor countries. They do not have structures in these African countries that will ensure that these projects or these funds are utilized and gets to the grassroots. And another thing is, we actually rely on the figures we get from the internet based on research and based on, okay, what problems are we to solve? But the truth is, when you go to the grassroots, you see that the information on the internet does not, in most cases, align to what the challenges are in these countries. Now, that is a very serious problem. And so I would say that one challenge is the fact that the people who carry out this project, because truth is, funds are already available for this project, but now those who carry out this project, they do not do, not all, some of them do not carry out extensive research to the grassroots, because I believe that for a cause to be very effective, you have to go to the grassroots of the problem, and you have to communicate with the people at the grassroots who are the recipients of whatever solution you are trying to bring. Now, if I want to start a project and I communicate with those at the grassroots, those who would be benefiting from. Okay, yeah. Okay, what is meant by grassroots? Okay, yeah. So grassroots are the people who are going to receive your service. That's your target audience, because for each project, each charity, there is a target audience, maybe women, maybe men, maybe children. So now and then there is also your geographical location where you want to address like these issues in. So now, for you to have for this project to be effective and for the people to feel the impact of this project, there has to be means, or the founders or those who want to start up this project have to reach out to the people, the primary people who are going to be receiving what you are bringing. Now, another thing is the fact that, like, I was having a conversation with someone and she wanted to have a project in Nigeria, and she is not in Nigeria. She doesn't have the contact of like lots of people in Nigeria. And that was a very big challenge for her. And now when she started discussing on the scope of her project, she was, due to the fact that she's not here, she doesn't know who are the people that really need this. She doesn't know who are the people that I should hear from. Yes, because channeling your solution to the right audience is also going to help to increase impact. So she was going to channel her solution to the wrong audience, because the people she was targeting are people in the rich areas of Lagos who can afford the services that she's rendering. Now, that was going to, for me, that would be a waste, kind of, because there are people in the poor areas who do not have access to this service, who do not have the means to provide the service by themselves. So those were the people she was to go to. And it was fortunate that we got to meet, because I had to help and redirect her, and I gave her some information that were useful. So now this is a major challenge. This is a major challenge in actually getting the most impact. Yes. And in this is one thing that restricts the effectiveness of some organizations work in these poor regions. So I'm gonna say this. I did a research and I found out that in EA there are 27 funding bodies. Now this is a whole lot, and there are over 50 charities in EA that are addressing various problems, and EA is actually on a course to make the world a better place, to impact lives, and particularly the lives of people in the poor region. So now, considering there are funds, what are we doing to reach out? Considering there are funds, so what are we doing to actually direct our services to the right people, which would actually bring about higher impact? So this is my thoughts on this. Thank you.
Thanks, Esther. Thanks so much. So I'm going to share some questions that can guide our discussion. Esther, if you have any additional questions, feel free to add that to the chat. But we have about half an hour left. We'll jump to breakout rooms